So during my talk at the iwCLL meeting, I bring up the question, are we ready for precision medicine for patients with CLL? And I argue that we already today are performing the two pillars of precision medicine. That is precision diagnostics. We use different genetic tests to identify patients with high risk. And we also have precision drugs that are that affect certain pathways, in particular BTK inhibitors and BCL2 inhibitors. And of course, there have been a lot of discussions lately and also during the iwCLL meeting. What is the impact of different genetic markers in the new era of targeted therapy? And yesterday, I summarized the impact of, for instance, P50 aberrations in the era of chemoimmunotherapy and what we have learned, if they still are relevant to identify in the era of targeted therapies. And in general, I would say that they are still important to detect P50 aberrations with FISH analysis and sequencing of the TP53 gene. If we go on for IDH mutation status, which we know is both a prognostic and predictive marker, we can see that in the with targeted therapy, at least for BTK inhibitors and also BCL2 inhibitors, the unmutated CLL group benefit strongly from these new targeted therapies. But the prognostic impact of the IDH mutation status is not so strong anymore with the new targeted therapies. For complex karyotype, there's been a lot of discussion with complex karyotype. We know that that is linked to a worse outcome with chemoimmunotherapy. So what about complex karyotype with novel agents? Of course, we need larger studies. It seems to be a strong negative prognostic marker in the relapse refractory setting, whereas it's not that clear yet regarding treatment naive patients. But I think that this will be also a predictive marker. Then we were also discussing other type of genetic markers, such as stereotype subset 2. And it has been shown in retrospective study that patients do not benefit from chemoimmunotherapy, but we are still lacking data regarding effect of targeted therapy. And finally, there have been a lot of interest regarding recurrent gene mutations, and that had been shown to be prognostic with previous chemoimmunotherapy. But if we look at the new agents, it's not, or we are partly lacking data, but there are, so far, they do not appear to have a strong impact, at least.